peripheral artery disease. What is that, doctor?
Peripheral arterial disease is not really known, Olga, because over the many years in the past, it was a condition primarily treated by vascular surgeons, and not really much was treated or known or taught in medical schools or residency programs for primary care physicians, internal medicine doctors, and the like. So peripheral arterial disease is a very common condition that requires medical attention, and it can prevent death, stroke, morbidity, mortality, and it's simply atherosclerosis, as you would have in a coronary artery, is atherosclerosis on the lower limbs and the legs of the patients.
And I remember when I used to help my dad in the office, and he's a vascular heart surgeon, I remember a lot of patients coming in and complaining of that pain in the lower limbs, and I would immediately see what he would do and get into action.
Absolutely.
So, but here's my question. A patient comes in, and now they're hearing us talk about it, and they're saying, okay, well, I have some pain in my lower legs. Could it be from my exercise? Could it be that I walked too much? Could it be that maybe my circulation is not really up to par? When does one get concerned, or when do you get the results you need to know that it's a little bit more serious than just maybe running a few more miles?
Correct. That's exactly correct. Very good question. So what I've been trying to do is educate our patients and now the public on how to differentiate pains in the legs, to make sure that this is peripheral arterial disease, and that's something that's also as common, if not more common, and that's joint disease or atherosclerosis of the leg. So you got to differentiate one from each other. So the typical scenario, we want to talk about the typical, because there are many that are atypical, and actually that's probably the majority of the patients with peripheral arterial disease. Leg pains that occur only in the muscles, very important. It's not the joints.
Okay.
It's not the knee joint or the hip joint. It's the muscles.